Okay, so ang topic po natin is all about the hospital information system. Okay, so when we say hospital information system po, this is fundamentally a computer system that could manage all the information to permit healthcare providers to do their jobs efficiently. Meaning, when we say hospital information system, ito po yung system na ginagamit natin sa buong hospital. And one of the main advantage po nito is nakakatulong ito sa ating mga medical staff na mas mapagaan po yung workload nila and also magawa yung kanilang trabaho ng mas efficiently. Okay? So this is the hospital information system. And one of the basic function din po ni HIS is billing and also the hospital inventory. Okay? Nakakatulong po siya pagdating sa billing and hospital inventory. Why? Kasi if your hospital is using an HIS, automatically po, nagiging centralized na po iyan. Okay? So, what are the main advantage po of the HIS? Or what are the benefits of the HIS? Number one benefits po ng HIS is first, it enhanced facts integrity. Okay? So, mas, yung mga data po na nai-input natin dito is mas reliable. Okay? And also, integrated na din po ito. Okay? Pangalawa, it reduce the transcription error. When we say reduce the transcription error, dito po nababawasan natin yung mga pagkakamali. Okay? Another one here is we also have here din po, reduce the duplication of fax entry. So when we say reduce the duplication of fax entry po, so ang nangyayari po dito, di ba, kapag manual method, nagdo-duplicate tayo ng resulta, ng record, para if ever po na mawala, meron tayong backup. But when hospital is using the HIS or the hospital information system, no need ka na pong mag-duplicate pa. Okay? Automatically, yung resulta po na na-encode mo sa pasyente, it will store in the information system. Okay? So that is the third benefits or advantage po ng HIS. Aside from that, it also optimized report turnaround time. When we say optimized report turnaround time, dito po, mas napapabilis, okay? Napapabilis po dito yung pag-release natin ng resulta. Okay? So, these are all the 4 benefits po or 4 advantages of using the HIS. Now, let's proceed naman po dito sa ating HIS for different departments. Okay? So, we have here first the nursing information system. When we say nursing information system po, this is a computer-based system. Okay? Of course, this is specially designed po para sa ating mga nurses. Okay? So, syempre, ang gumagamit po nito is yung ating mga nurse. Okay? And one of the main function po ng NIS or ng Nursing Information System is number 1, it improved the personal schedule. Okay? So for example, I am the nurse and sabihin ko, nagbakasyon ako, pumunta akong Boracay. Now, gusto ko po malaman yung schedule ko. Okay? So of course, kahit nasa Boracay po ako, mag-i-input lang ako doon or mag-login lang ako sa system. Of course, through online. And then makikita ko na po yung schedule ko. Okay? Another one function pa po ni NIS is nagkakaroon po dito ng accurate patient charting and also better clinical data integration. Okay? So when we say patient charting, okay, this is also one of the function din po ni NIS or ni Nursing Information System. Okay? So syempre, di ba, may na ginagamit ng mga nurses natin is nagpi-patient chart sila. So, dito po, yung kanilang patient charting, meron na ding application. Kung saan, ikaw as a nurse, mas, you can go deeper po in the details of the patient. So, mas mapag-aaralan mo po siya, as well as makikita mo yung mga critical sign ng pasyente, or kamusta ba yung pasyente, mas mamamanage mo po ng maayos. Okay? Aside from that, one of the function din po ni NIS or the Nursing Information System is nagko-collect, retrieve, and also examine the medical record, after which integrate it to design a patient's care plan. Okay, so yan po yung function ni NIS or ni Nursing Information System. And of course, di ba nga sabi natin, mas nagagawa po nitong efficient yung trabaho ng ating mga medical staff. So, ang laking tulong niya in terms sa ating mga nurses. Okay, ang NIS po, this is specially designed, of course, for our nurses. Okay, and that is one of the HIS po for different department. Another one, we also have here the Physician Information System. So, when we say PIS, okay, so syempre po, of course, ang meaning gumagamit ito is yung ating mga physician or yung mga doctor po natin. So, dito po sa PIS, integrated po dito or nakaprogram na po dito yung mga medical record ng pasyente. Yung tinatawag natin na EMR as well as the EHR. Okay? Integrated na po siya dito sa PIS. So, for example, I am the doctor and I want to see the record of my patient para mas ma-manage ko ng maigi kung ano ba yung sakit ng pasyente ko. Okay, isang click ko lang po and automatically I can see na yung mga EMR and EHR ng pasyente ko dito sa PIS or using the Physician Information System po. As well as ang PIS din po, nag-o-offer ito ng 24/7 support. Para if ever na magkaroon po ng problema sa system, madali lang tawagan and mariresolbahan agad yung problema na yon. Okay, so this is po the PIS or the Physician Information System. So, specially designed po ito para sa ating mga physician. And sila po ang gumagamit nitong system na to. Okay? Another one pa po is we also have here the RIS. When we say RIS naman, this is the Radiology Information System. Okay? So, itong system na po ito, of course, this is specially designed naman for our RadTech or sa ating radiology department. One of the main function po nito is the billing as well as the appointment scheduling. Okay? So, yan po yung function ng ating RIS. And dito din po nag-i-encode as well as dito rin nai-store yung mga different images ng in terms po sa radiology. Okay? So, mas nakakatulong talaga ito. So, that is the RIS. And that is specially designed po for our RadTech. Aside from that, we also have here another one pa po. We have here the PIS or the Pharmacy Information System. So, siyempre po, pharmacy, this is specially designed for our pharmacy. Okay? Sa ating pharmacy department, ito po yung ginagamit nilang system. Okay? Itong PIS or Pharmacy Information System. One of the main function naman po nito is natutulungan nito yung ating mga pharmacy na ma-monitor po yung medicine na nai-utilize nila doon sa hospital. As well as dito din po is nakikita na ating mga pharmacists kung halimbawa yung isang pasyente, meron ba siyang allergy doon sa gamot na yon? Meron bang medication-related complication? So, syempre po, pag nalaman na nila, madali nilang mapalitan yung gamot and matreat yung pasyente. Okay? So, na-identify po nila dito yung drug interaction. At the same time, ang PIS po or ang Pharmacy Information System, malaki po yung natutulong ito pagdating sa inventory. Di ba? Sabi ko nga sa inyo, kapag manual method po ang ginagawa, di ba? Inaabot ng isang linggo sa pag-i-inventory. But of course, if the hospital is using the HIS, mabilis lang po ang inventory dito kasi it is already encoded in the system. So once na may bumili ng gamot, automatically nababawas na po siya. Okay? So mas magaan po ang work kapag talagang merong HIS yung isang hospital. Okay, so now, for example naman po, if you are the owner of the hospital, okay, sabihin natin, you are the owner of the hospital and now you want to shift from traditional manual method to an automated method. Gusto mo po ngayong bumili ng HIS. Okay? So, here are the factors to consider po in buying a HIS. Okay, ito po yung mga factors na need mo i-consider kapag bibili ka ng hospital information system or when you are selecting a hospital information system. Number one po is the total cost of package. Okay? So total cost of package po, kailangan madidiscuss mo yung necessity ng iyong hospital. Okay? So baka mamaya ang bibilhin mo pala is hindi pasok doon sa budget mo. So kailangan po madiscuss mo yan sa pagbibilhan mo ng HIS, okay? Dapat pasok siya sa budget mo as well, pasok po siya doon sa size ng hospital mo. Baka mamaya may ino-offer sa'yo pang tertiary, pero yung hospital mo pala pang secondary lang. Okay, so dapat yung make sure, okay, or you need to consider po in selecting a hospital information. Number 1 is the total cost of package. Pasok sa budget mo po and also pasok din siya dun sa sizes ng hospital mo. Okay? Number 2 naman, okay, when selecting a hospital information, another one that you need to consider po is dapat merong magandang web-based system. Okay? So when we say web-based system, dapat po it is user-friendly. Okay? So syempre, when we say user-friendly, madali po siyang gamitin. Hindi siya ganun ka-complicated yung system na yon. At the same time, dapat din po, it should be available on the internet. Bakit po available sa internet? Para po, of course, yung mga empleyado mo po, ma-access nila sa internet yung mismong HIS. Okay? Para kahit nasaan sila, ma-access nila. At the same time, maaral nila yung case ng pasyente. Okay? And another one is implementation and support. This is also one thing that you need to consider po, the implementation and support. So, dapat po, okay, so as I was saying po, in implementation and support, dapat po yung make sure na nagbibigay po ng 24/7 support either through telephone or web. Para for example po, nagkaroon ng problema, ay madaling marisolbahan. At the same time, another one pa po is dapat nagpo-provide po ng training yung mapipili nyong HIS provider. Bakit po? For example, meron kang hinire na bagong medtech and bagong nurse. So, syempre po, hindi mo naman yan pwedeng agad-agad isa lang. Okay? So, kailangan po dadaan din yan ng training. Okay? So, dapat po merong magandang implementation and support. So, these are the 3 factors po that you need to consider in buying or selecting a hospital information system. Number 1 po is the total cost of package. Number 2 is the web-based system. And then number 3 is the implementation and support. Okay? Now, we also have here din po the HIS provider dito sa Pilipinas. Okay? Meron po tayong HIS provider dito sa Pilipinas. Number 1 here is the Bizbox. Ang Bizbox po, nag-start ito 25 years ago kung saan nag-evolve siya as one of the top IT company po na nakafocus in the healthcare industry. And ang Bizbox po, they are also proud to be a Microsoft Gold Certified Partner. And they are also the recipient po of the ISB of the Year Award. Okay? So that is the Bizbox. And if Bizbox po, okay, alam niyo yung FUMC or the Fatima University Medical Center, ang gamit po nilang HIS is the Bizbox. As well as Antipolo Doctors Hospital, ang gamit din po nilang HIS is Bizbox. Okay po. Another po, we also have here another HIS provider in the Philippines. Okay? So this one po is the KCCI Medsys. So ang founder po ng KCCI Medsys is si Kaiser de la Cruz. Okay? Na-establish po ito noong 1990. And they are specialized po in the application development ng mga hospital as well as ng mga medical school. Okay? So this is the KCCI Medsys. And one of the hospital po na gumagamit nito is the St. Luke's Medical Center. So yung gamit po nilang HIS is the KCCI Medsys. Okay? Ng St. Luke's. Okay po. Next. Another one. We also have here din po the Comlogik. Okay? Comlogik naman po, this is a Philippine-based software development company. Na-establish po ito noong 1999. And they have a vision to be a global technology company. Ang kagandahan po ng Comlogik is yung pasyente po, ma-access niya online yung kanyang billing as well as yung kanyang examination result. Yan po yung kagandahan ng Comlogik. Okay? So again meron po tayong tatlong HIS provider dito sa Pilipinas. Number 1 po is the Bizbox. Pangalawa, we have the KCCI Medsys. And then pangatlo po is the Comlogik. Okay? So yan pa lang po, tatlo pa lang po yung HIS provider natin sa Pilipinas. Okay? Now, let's proceed naman po to the processes Ano ba yung mga processes na ginagawa po natin using the HIS? So we do po, or the function ng HIS is the help desk, scheduling, patient registration, admission, discharge, transfer, and also the billing. So isa-isahin po natin. First, let's discuss po the help desk. Okay. These are the processes po na ginagawa natin under the HIS. Okay. Help desk po. Ang help desk, this one po is nagpo-provide po ito ng information and guide sa mga customer or sa mga pasyente. One of the example po nito is, halimbawa, you are the patient or you are the relative of the patient. Ngayon po, gusto mong malaman yung services na ino-offer ng hospital. So, syempre po, di ba, mag-search ka through internet. And then automatically, once na nag-search ka po sa internet, makikita mo ngayon or madadirect ka po dun sa isang page ng hospital and makikita mo yung mga services na ino-offer ng hospital na yon. Okay? So, when we say help desk, nandiyan po yung mga information and guide. Okay? Na para malaman mo ano yung services na ino-offer ng specific hospital. Okay? Another one here pa po is the scheduling. This is also the processes under HIS or this is also the function of the HIS, the scheduling po. So ito po yung sinasabi ko sa inyo, yung manager and employee, kaya pong ma-access yung kanilang work schedule kahit nasaan po. For example, I am the medical technology and sabihin natin nagbakasyon ako, pumunta ako ng Batangas. Ngayon po, no need ko nang tawagan yung katrabaho ko para sabihin na, oy, picturean mo nga yung bulletin board natin, yung schedule. Kalimutan ko yung schedule ko. No need na po. I will just access it through online. So, mag-login lang po ako dun sa system online. And then, automatically, makikita ko na po yung schedule for this week. Okay? So, di ba, ganun kaganda yung HIS. Okay? Another function pa po, or another process that we can do in the HIS is the patient registration. So, sa patient registration po, of course, dito po natin ini-input or ini-encode yung mga information ng pasyente, yung mga basic information po ng pasyente. Okay? So, pagka-inpatient po, nag-i-encode po nito is yung ating admission counselor. Okay? So, dito po nakalagay, last name ng pasyente, first name, ayan. So, saang ward siya, na-admit, sabihin natin na-admit siya. Okay? So, once po halimbawa na na-encode na yung pangalan ng pasyente or once po na na-registered na ito sa system, automatically po it will be integrated. When we say integrated, makikita na po ito ng lahat ng department. Okay? So, for example, I am a nurse. So, makikita ko na po yung information nitong pasyente na to sa NIS. For example, I am na medtech. Okay? Makikita ko na po yung information na to ng pasyente sa LIS or sa Laboratory Information System. Okay, so integrated na po. So lahat ng department, makikita na po yung information ni patient. Okay? So also, before, okay, pag halimbawa po traditional manual method, tatawagan ka ng doctor or ng nurse. Ma'am, pa-extract naman po si patient ganito sa OB ward. Okay, CBC po. So, aakyatin mo pa yan. Kasi nga tinawagan ka. But kapag po yung hospital nyo, they are using HIS or the Hospital Information System, no need ka na pong tawagan. Kailangan ma-monitor mo lang yung system. Ino-notify ka po ng system. Magre-red siya dito. Magtatag po yan. Once naka-red po yan, okay, automatically po makikita mo, may need kang extrahan. Nag-request yung doctor na need mong extrahan si ganitong patient. And automatically, aakyat ka na po doon. Okay? Extrakan mo na siya. Okay? So, dito po makikita mo lahat ng information ni patient. Another advantage pa po ng HIS, pagka-traditional manual method po, okay? Pag halimbawa yung nurse, hindi mo pa nare-release yung resulta. Okay? So, sabihin natin stat. When we say stat, kasi kailangan, emergency po yan. Kailangan ma-release mo agad yung resulta. Ngayon, tatawagan ka ni nurse. Ma'am, may result na po ba si ganito? Paakyat na lang po dito sa OR kasi for operation yung pasyente. Okay? So, syempre po, kailangan madaliin mo yung resulta. Okay? Kailangan magawa mo siya agad at nakon mo kasi nga for operation si patient. Okay? Pero po, kapag halimbawa yung hospital mo, they are using HIS or the Hospital Information System, hindi ka na po kailangan kulitin pa ni nurse. Okay? I-check na lang po dito sa system, kasi dun sa NIS, kasi NIS ang gamit nila. And then, pindutin niya lang tong laboratory dito sa baba. Ayan, meron pa po yung function dyan sa baba, laboratory result. Okay? Bawa, tapos ka nang mag-encode. I-check na lang po yan, pipindutin niya dito. Makikita niya na yung laboratory result ng pasyente. Okay? Ganun po siya ka-integrated. Okay? So, hindi mo na kailangan umakyat pa doon sa OB ward, sabi natin sa second floor yon para i-release yung resulta. Pag kailangan na, ito-check lang po yan ni nursing. Ito-check lang po yung ni nurse. Okay, check niya dito, pindutin niya yung laboratory, then makikita niya na po yung laboratory result ng patient. So, di ba? Ganun po kaganda yung nagagawa ni HIS. So, it is already integrated. Once po na na-input mo yung information ni patient, lahat po kayo na medical staff, ma-access nyo po. Okay? So, ganun po siya. Another process din po is we also have here the admission. So, ito po yung sinasabi ko sa inyo. Of course, pag halimbawa po i-admit yung pasyente, ang magko-collect po ng lahat ng mga information niya is the admission counselor. And then, i-input po yan doon sa mismong system. And then, of course, si physician po, ma-access niya na yan. And then, pwede na po siya ngayon mag-request ng mga test na gusto niya ipagawa doon sa pasyente. For example, laboratory test. Okay, sabihin natin CBC, creatinine. Okay, matatag na po ngayon si laboratory. And of course, kami po sa laboratory, check ko lang yung system. Once na nag-notify, alam ko na po. Okay, so ganun po siya ka-integrated. Okay, so di ba mas nagagawa natin efficiently yung trabaho natin if the hospital is using HIS. Okay, so that is the admission. And that is one of the function po or one of the processes under HIS. Another one din po, process under HIS is the discharge. Okay? So, ang discharge naman po, this is kung saan yung pasyente is discharged na or aalis na po siya ng hospital. Okay? Pwedeng, ayun, of course, discharge, uwi na siya sa kanilang bahay. Okay? So, dito po sa discharge, of course, meron tayong tinatawag na discharge summary. Okay? So, nakalagay po dyan, pinipirmahan po ng ating mga doktor. Okay? As well as nakalagay din po dyan yung discharge planning. Halimbawa, yung pasyente, babalik pa ba siya ng hospital or di kaya naman, yung patient is mag-undergo pa ng hospital services. Pupunta yung physical therapy sa bahay nila. So, depende po doon sa discharge planning. That is one of the function or processes po under HIS. Okay? Another one pa po, processes under HIS, is we also have here then the transfer. Okay? So, transfer naman po, this is movement. Okay? Ibig sabihin po, yung pasyente is lilipat ng other hospital facility. Okay? So, pero kailangan po, dapat dito merong permission ng authorized person. Of course, dapat may permission to ng doctor. For example, nasa secondary hospital siya. Okay? So, syempre po, lilipat siya ngayon sa tertiary hospital kasi nga hindi kaya ng secondary hospital handle yung case niya. Okay, di ba sabi natin pag secondary hospital, limited lamang po yung services na na-offer niya. So, yun. So, dapat po nakasulat yan dyan sa transfer slip. Okay? And this is also one of the processes po na nagagawa natin under the HIS. Okay po. Another one pa po na processes na nagagawa din natin under HIS is the billing. Ang billing naman po, dito makikita natin kung meron pa bang outstanding balance yung isang pasyente. Okay? So, sa billing po, for example nito, nung nasa public hospital ako, we are only using traditional manual method. Ngayon po yung pasyente, once na i-discharge na yung relative niya, okay? So, yung relative po, may hinahawakan niya para silang clearance form. Okay? So, pupunta yun na iba't ibang department. Papipirmahan niya po yan sa laboratory. Meaning, wala na silang outstanding balance. Ngayon po, kakatok yan sa laboratory. And then, dala-dala niya yung clearance form. Tapos, sasabihin niya, ma'am, may utang po ba akong blood bag? Okay. So, syempre kami sa medtech, bubuksan po namin yung logbook and then hahanapin namin kung may utang ba silang blood bag. Okay. So, once po nawala ng utang, pipirmahan namin yung papel. Okay, na-cleared na siya. Okay, so ganun po, pagka-traditional manual method. Pero po, kapag yung isang hospital, they are using the HIS, no need na pong mag-ano yung relative ng pasyente. Automatically, in terms po sa billing, this is already centralized na. Okay, so nakikita na po agad yan ng billing department kung meron pa bang outstanding balance yung pasyente sa iba't ibang department. So, hindi na po magpapalakad-lakad pa yung relative ng patient para asikasuhin ito. Okay? So, isang punta niya lang po sa billing and then malalaman niya kung ano pa yung mga outstanding balance niya doon. Okay? So, diba, ganun kaganda yung nadudulot po ng HIS. So, this is already centralized. Another one function, okay? We also have here din po the laboratory, radiology, as well as the cardiology reporting. So, una po natin pag-usapan yung ating laboratory reporting. Okay? So, sa ating laboratory reporting po, kung papansinin nyo, lahat ng laboratory report, nagpo-process po yan ng common elements. Okay? So, bakit po? Of course, we are following standard method po. Okay? So, yung makikita nyo dapat in a laboratory result, okay? Ito po dapat yung makikita nyo sa isang laboratory result. First is the patient name and also the identification number of the patient. So, dapat po makikita nyo dyan yung pangalan ng pasyente as well as yung identification number niya. Another one pa po, dapat makikita nyo din po dyan yung name and also yung address po ng laboratory or ng hospital. Diba? Kung papansinin nyo, for example, nagpa-laboratory test kayo. Diba sa taas po niyan, makikita nyo yung pangalan ng hospital or ng laboratory as well as yung location. And then sa kanan bandang part, makikita mo kailan pinrint po yung result. And then yung test report date, kailan yan na-report yan. As well as, dapat po nakikita din kung sino yung doctor na nag-order ng test na yon. And also, dapat po makikita nyo sa laboratory result din, yung sa specimen. Okay po? Yung information regarding doon sa mismong specimen. And also, yung date and time of specimen collection. For example po, urinalysis yung gagawin nyo. Okay, dapat nakasulat po doon kailan kinolect yung specimen na yon. Okay, as well as the laboratory accession number and also yung name of the test performed. Anong test po yung perform na yon? Also the test result, abnormal test result, and also the critical result. Okay? Wait lang po. Pakita ko sa inyo na ba ako. So, ayan. So, as I was saying po, ayan, dapat nakikita nyo yung name of the test performed. Okay, so, ayan. So, halimbawa, ang test po na perform is the FDS. Okay? So, dapat po nakikita kung anong test yung perform. At the same time, dapat po nakikita nyo rin yung unit of measurement. Okay? So, dito po, sabihin natin yung unit of measurement. Ang gamit po nito, ayan yung example po ng unit of measurement is milligram per deciliter. Okay? Or di po kaya millimole per liter. Okay po? Aside from that, okay, another one pa po, dapat nakikita nyo rin yung reference interval or yung reference range po. Okay? So, dito po sa FDS or sa glucose, ang reference range po niyan is 70 to 100. Okay? So, dapat po nakasulat din yan dun sa mismong laboratory result. Okay? And also, yung interpretation po ng result dapat nakasulat din. So, ito yung resulta. Okay? Sabihin natin FDS glucose ng pasyente, result niya po is 225. Okay, so sabi natin dapat nakasulat yung unit of measurement. So yung unit of measurement po na ginamit sa FBS is milligram per DL or milligram per deciliter. And then sa katabi po niya nakasulat yung reference range which is 70 to 100. Okay, so syempre po dapat nandiyan yung interpretation nakalagay high. Ibig sabihin mataas po yung glucose ng pasyente. Okay, so yan po dapat ganyan yung pagkakasulat sa mga laboratory result. Diba kung papansinin nyo naman once nagpa-laboratory kayo, nakikita nyo yung pangalan ng test as well as yung result po, and then yung units of measurement na gamit, as well as the reference range. Okay, so ganyan po dapat when reporting a laboratory report. Okay, or when reporting a laboratory result. Okay po. And then, dapat din po, sinusulat natin yung medication. For example, yung pasyente po is nagtitake siya ng medication. For example, yung pasyente umiinom siya ng rifampin. So, ang rifampin po, nagbibigay kasi ito ng red color pigment sa urine. Okay? So, dapat po ina-asterisk yan sa baba. Halimbawa, merong iniinom na medication yung pasyente, dapat po sinusulat din natin. Okay? And then, sa pinakailalim po nito, ipirma po tayo. Okay? So, nakalagay po, performed by Geraldine D. Junco, RMT. When you say RMT, that is Registered Medical Technology. Okay? And then, pipirmahan ko po yan. So, ibig sabihin, ako po yung gumawa ng test na yun. Okay? So, ganun po siya. And then, sa kabilang side, may pirma din po yan ng pathologist. Okay? So, ganon ang pagre-report po ng laboratory result. Okay po? Another one is the radiology reporting naman po. Sa ating radiology reporting po, dapat nakalagay dyan yung length of the report. Kailangan po it have some relationship dun sa complexity of the exam. Kailangan din nandyan po yung positive and negative findings na naka-address doon sa clinical concern, as well as yung mga important findings po, dapat naka-stated doon. Okay, ang pinaka-radiology report premises po, dapat daw nasasagot nito yung mga clinical question from the radiology request. Okay, so dapat po ang pinaka-main components, dapat nakasulat yun yung patient demographics, name po ng pasyente as well as the identification number, also yung relevant clinical information, body of the report, as well as the impression po or yung conclusion or diagnosis. Okay, so yan po dapat yung reporting pagdating sa radiology. Okay, aside from that, we also have here din po the cardiology reporting. So sa cardiology reporting naman po, this is post po for the vascular sonography. Okay, so yung vascular sonography po, dapat nandito po nakasulat yung result regarding sa ultrasonic ultrasound. Okay, so dapat po nakasulat dyan kung halimbawa ba merong presence of plaque, nakaroon ba ng narrowing, or meron bang presence of clots doon sa artery or sa vein ng pasyente. And of course, kung gumagawa nito is yung ating mga cardiologists or yung mga physician natin. Okay? So, ayan po siya. Next. Aside from that, we also have here din po the discharge summary. So, this is also one of the function din ng ating HIS or ng ating hospital information system. So, of course, ang gumagawa po nito is yung ating mga health practitioner or yung ating mga medical doctor. Okay? So, dito po nakasulat yung pinaka-main complaint ng pasyente, bakit siya pumunta sa hospital, ano yung sign and symptoms na naramdaman niya, as well as ano po yung naging diagnostic finding sa kanya ng doktor. For example, nagkaroon po siya ng dengue. Okay? And then, dapat din po nakasulat dito, ano yung treatment na binigay ng doktor doon sa pasyente and paano po nag-response yung patient. So, syempre, discharge na po siya. Of course, gumaling po yung pasyente. And that is a discharge summary po bago pauwiin yung pasyente. Okay po. So, ayun lang po. That's the end of our topic for today regarding HIS.